Hi ladies, it's Shannon at maidendish.com. We're here today to go on a little bit of a field trip. I'm in my car. We're on our way to go to Remington Laser Dermatology Center. I've been coming here for about 9 years now, and the doctor I see, his name is Dr. Kent Remington, and he's fabulous. About 9 years ago I heard an ad on the radio, or I maybe heard something from somebody that said if you get Botox done, it'll get rid of migraines. And I was suffering from migraines at the time, so I thought I'd give it a try. I got a hold of Dr. Remington, went in, got some Botox just in this area here between my eyebrows, because I did a lot of squinting and scrunching, and I got that done just in this one part here. Now it was good to do because it didn't really get rid of my migraines. That wasn't the good thing, but the results that I got from the Botox, where this completely disappeared. I could no longer scowl. I didn't look like a deer in the headlights, you know, but I had this nice smooth appearance here. And as the years have gone on, I've gotten Botox between here, around my eyebrows, and some filler down in here on my laugh lines and above my lip. I go about every 4 months for Botox, and for fillers I go maybe a little longer, every 6 to 9 months, depending on what the filler is and what location it is on my face. Why do I do it? I do it for preventative measures. Dr. Remington says it's all about prevention, and that's why I do it. I started going 9 years ago, like I said. When I go in for my appointment today, he'll probably have me scowl and do some frowns so he can locate on my face where he needs to put the Botox and the filler. He does it just enough to take the edge off and make me look fresh and more young. Now they say avoid green tea, alcohol, and ibuprofen, among other things. And you can check out Dr. Remington's website at Remington Laser and Dermatology Center. And you also want to keep very hydrated. Drink lots of water before and after. That's always a good thing. It keeps you hydrated and it keeps the blood flowing so you can heal quicker. Usually I do bruise a little bit, so hopefully this will be a learning experience for you. I wanted to document it for you because so many people, my friends and acquaintances, have asked me over the years, what's it like? How does it feel? So I'm going to take you with me to my own personal appointment today. I've gotten permission from Dr. Remington, and it's going to be a fun little field trip, so come on, let's go. Okay ladies, we're here at Dr. Remington's office, Remington Laser and Dermatology Center. I'm excited for my appointment. Let's go in and check it out and get all Botoxed and filled up. Come on. Hello ladies, I'm in the treatment room here at Dr. Remington's office. I'm in one of the treatment rooms here waiting to get my Botox and my fillers and my face looking good again. So stay tuned. We're coming at you.
My name is Dr. Kent Remington. I'm a dermatologist in Calgary, Alberta, and my focus the last 15, 16 years has been strictly aesthetics, where we're trying to make patients look more youthful. And the Canadian way is trying to make you look your age, trying to look awesome for your age and not looking done. Sometimes the American way is a little overdone, and we'd like to have patients have their features accentuated, their best features, and I always tell patients with their Botox and fillers, if someone says, oh Shannon, you've had Botox and fillers, were a failure, because it should just look natural.
They never ask.
So your genetics is outstanding. If you don't have good genetics, it's hard to make you look really good.
Thanks, Mom.
Most people get in their early 40s, they start looking in the mirror and saying, why don't I get the comments that I used to get how good I look? And it's usually just a few little subtle things, because we all sink, sag, and wrinkle.
Yes.
If you don't want to do that, then you got to find some other planet. So if you look at faces, they're all about genetics, and genetics is all about biology. Mm-hmm. Biology is all about physiology, and physiology is all about physics, and physics is all about math. So essentially faces are all about math. So this is something, if you look in the mirror,
Okay.
that Michelangelo or Leonardo da Vinci would have used. The cream we use is sort of like amla that many patients have heard of before, but it's double strength. So it's 5% xylocaine and 5% prilocaine. It's the prilocaine in it that creates some vasoconstriction. So there's two reasons for using numbing. One is it just takes the edge off a little bit of these little tiny needle sticks, and the other is it blanches the skin and it causes vasoconstriction. So that makes the skin a little white, so you have the least chance of bruising. Little crow's feet. So because she uses this muscle away from that part of the crow's feet, it's called a zygomaticus major. It's a muscle. So you do tiny, tiny droplets here, and a little bit, look up to your left. Tiny, tiny droplets here. And then you just... Not fun. Remember what your grandmother would say, no gain without a little discomfort. So way she has less chance of bruising because it's like a little hollow tube. Like, go now. And we just use the filler this way rather than a needle. It looks like a needle, but it's a hollow tube. So it's a little less sensitive for patients. Open your mouth a little bit. And it helps to erase all these little lines on the lip. Just the way it works. We can get above the lip as well. It's not too much fun. But
It's okay.
it's now there's it feels a little odd.
Yeah.
How's your scientist doing over there?
You're doing good, Jake.
This looks gnarly, actually.
He's used to watching it on TV. This is kind of neat, eh?
It's weird.
Now, it doesn't hurt that much, right?
No, it's an odd feeling.
Most people hardly tell us that it doesn't hardly hurt at all. You know, it's a little annoying, but it's not bad.
It's always worth it to me.
But we've been missing her brow structure for a while here, so this will just give her a little boost here.
Hi ladies! Thanks for coming with me on my field trip to Dr. Remington's office. I hope you had a good time with me. I know it was a little graphic at times, but it gives you an opportunity to see what it's like to get the Botox and the fillers, and if you've already had it done, then you have an idea of what you look like when you get it done. Thanks again for coming with me. Subscribe and share to my channel on YouTube and my blog, www.madeanddish.com. And we'll see you soon. I post often, so come back and share with your friends. Bye-bye.
Madeanddish.com. Madeanddish.com.
Madeanddish.com.
Madeanddish.com.
Let's dish beauty. Let's dish beauty.